Welcome to Care Work Unpacked, a short lecture by Dr. Microlearning that explores the role of care work across community, health, education, and the economy. Over the next slides, we'll unpack why care matters, who does it, and how focused microlearning can support carers in everyday practice, improving outcomes for both workers and the people they support. On this slide, we see the dual nature of care work. Obvious tasks like medication administration sit above the surface, while a much larger set of invisible activities, emotional coaching, cultural translation, and care coordination lie beneath the waterline and often determine whether treatment succeeds or fails. Microlearning offers a practical way to empower carers through short, focused content that fits into busy days. By delivering targeted 3 to 10-minute knowledge bursts that slot into routine workflow and capitalize on brief pauses, we create high-impact learning moments that turn small pauses into real skill gains and immediate improvements in care. When carers face unfamiliar equipment or updated protocols, concise just-in-time refreshers can make all the difference. Instant access to brief, targeted training modules on a device keeps learning close to the client, lowers error rates, and boosts confidence, so carers can continue focusing on safe, effective care without lengthy interruptions. Care work includes both formal and informal roles, and both deserve recognition and support. Formal carers often have contracts, paid workloads, and professional development, while family carers provide unpaid but often larger hours of care based on obligation. Despite these differences, both groups need skill updates, resources, and respect to sustain quality care. Clear role definitions help prevent duplication and close gaps, and that's where microlearning modules shine. By tailoring short modules for nurses, therapists, social workers, and community health workers, we align responsibilities, reinforce complementary skills, and create smoother coordination across teams and settings, improving continuity and clarity in daily practice. Microlearning reinforces universal micro-skills through short, repeated loops, so core practices become automatic. Simple, frequent refreshers on safe transfers, infection control, motivational communication, and digital documentation build procedural competence over time, keeping patients safer and making everyday tasks quicker, clearer, and more consistent for carers. Heavy caseloads and ongoing emotional labor drive exhaustion among carers, undermining performance and well-being. Microlearning provides a practical solution by offering self-paced renewal that respects limited attention spans and focuses on immediate practical wins, helping carers regain confidence, reduce small errors, and protect their own resilience on the job. Short, frequent refreshers outperform one-off workshops when it comes to embedding action. 5-minute refreshers repeated over weeks build procedural memory and reduce errors in medication and care steps, while day-long workshops often succumb to the forgetting curve, leaving higher risk of missed actions when staff return to busy practice. Small micro-skills accumulate into meaningful outcomes when applied consistently across home and facility settings. Rapid skill mastery produces visible competence that elevates carer morale and patient trust. And by demonstrating reliable capability, we can reduce turnover intentions and improve long-term retention across care teams. To make learning habitual, microcourses need to be woven into everyday workflows. Quick shift huddles, timely app push notifications, routine integration into daily tasks, and on-the-job AR overlays turn education into a default activity rather than an extra burden, ensuring ongoing skill reinforcement is both practical and sustainable. Reframing care as skilled labor requires practical incentives and clear pathways. Micro-credentialing, wage incentives, and defined career ladders signal professional status, help attract and retain talent, and ultimately support quality outcomes for aging populations by recognizing the expertise and commitment of carers.